This week, we are going to look into the chiropractic profession. So I'm going to do my best to fill you in on some of the background information, the history of this profession, the scope of practice, the modalities used, the education, and all of that kind of stuff for the chiropractic profession. So I'm not a chiropractor, as I know you guys know, but I have been doing some research on the chiropractic profession. I know quite a few chiropractors, as I'm sure many of you do as well. The chiropractic profession is actually probably of the holistic modalities we're going to be talking about, it's definitely the largest. So, and it has a very interesting history, and there's some colorful characters. So we've got some colorful characters, to discuss. So last week we talked about osteopathic medicine, and chiropractic was one of the offshoots of osteopathic medicine. And by all accounts, it seems like the founders of the chiropractic profession were actually students of what appears to be Andrew Still, at least one of them. So let's kind of take a look here. So the term chiropractic comes from two words, which you can see, chira and praktikos, which essentially translates into done by hand. So as I just said, the chiropractic profession is the largest of the natural health systems in the United States. It's actually the third largest independent health profession in the world, following allopathic medicine and dentistry. So there's a lot of chiropractors, and the practitioners are kind of our port of entry providers, and they are licensed for both diagnosis and treatment. But they have kind of an interesting scope of practice. We'll talk in more detail about this later, but the chiropractor's scope of practice does not include surgery, major or minor, and it does not include the right to prescribe pharmaceuticals. The centerpiece, if you will, of the profession is manual medicine, so manual adjustment or manipulation of the spine. Although that's kind of changing, and that's part of and there's a little bit of drama, I guess I could use that word, in the chiropractic profession, and we'll get into that a little bit. So, but the true scope of practice for the chiropractor is really manipulation of the spinal segments, the spinal cord, as the spine and subluxations and such, which is that manipulation is the manipulation practices and techniques are similar to some of the types of techniques that are practiced by the osteopathic profession. And so again, that this profession is an offshoot of the specific portion of osteopathic medicine, which is the manual medicine portion. So I don't know how many chiropractors exactly there are currently in the United States, but I looked around for a hard and fast number, and I couldn't find an exact number, but I would comfortably say that there are more than 70,000 chiropractors in the United States. And I would put that well over 100,000 worldwide. And like I said, this is the most popular, if you will, I'll use that word popular just in terms of numbers, of the natural health or the holistic health modalities. And actually, chiropractors receive more patient visits than any other health profession per year. And if you remember, I said a minute ago that the chiropractic profession is second only to allopathic medicine and dentistry, but they still do receive more patient visits, more patient contacts. And that's part of what the chiropractic profession sort of is very good at. It's good at maintaining strong patient base, and it's good at getting patients to come repetitively, and that's part of their treatment plan in most cases. All right, so I think I've covered everything in there. So their central philosophy, so they've got very strong roots in the CAM community and in sort of the holistic health theory. And their central philosophy really emphasizes healing the body without drugs. They are not licensed to prescribe medications. So that's going to be one difference between the osteopaths and also the naturopathic profession, which we're going to talk about next week. So I mentioned already the scope of practice. I got ahead of myself. No surgery, major or minor, no prescription, no prescribing of pharmaceuticals. And really the crux of their treatment is to adjust. So manual adjustment or manipulation of the spine. They do have very rigorous educational standards, and the standards are supervised by a government-recognized accrediting agency, one of which is the Council on Chiropractic Education in the United States. So essentially, a person who's interested in becoming a chiropractor would fulfill a general college science prerequisites, and then basically the same prerequisites you'd need to apply to osteopathic school, conventional medical school, naturopathic school. It's all sort of the same. You go in you get a bachelor's degree, and then you have to, if you don't get a bachelor's degree in science, then you would have to complete your general science prerequisites. And those are things like, biology, chemistry, generally inorganic and organic, physics, those sorts of things, a certain amount of math. In most cases, I think it's up through college level calculus at the minimum. And then they can apply to chiropractic school. And once they apply to chiropractic school and are accepted, chiropractic school is a 4-year program. And it's going to have, depending on the school, it's going to have a basic science component, which is going to be similar to all of our medical professionals, allopathic, osteopathic, naturopathic, where they're going to do anatomy, physiology, pathology, etc., diagnosis. But they're also then going to learn an additional modality, which is going to be spinal adjusting, physical therapy, rehabilitation. They'll do some public health, which would be common throughout all of those programs, and nutrition. They're going to do a fair amount of nutrition, which is not the case definitely not in allopathic medical school. And with osteopathic medicine, they do some, but not as much as they're going to do probably with chiropractic. Most of the people who come to the chiropractor are going to be coming because they have pain, right? You saw that when we looked at the NIH's CAM study, we see that the number one reason, for people to kind of examine or experiment with a lot of these holistic therapies is because they have pain. That's the number one reason that brings them in. And so more than 90% of people who come to chiropractors have some sort of neuromusculoskeletal complaint. Usually it's going to be back pain, but it can be neck pain, it can be headaches. These are all conditions for which spinal adjustment is effective, or manipulation is effective. So this was a quote I found from a chiropractor, which says that the most common perception of chiropractic by the general public is that of forceful manipulation of the spine to address back and neck pain. Indeed, some chiropractors themselves would agree with this view of chiropractic as a form of manual manipulation, limited to mobilizing joints and helping repair joint damage. The majority of the profession, however, along with most patients who use chiropractic as their primary form of healthcare, recognize that chiropractic adjustments also free up the nervous system by reducing nerve interference. This frees the various body systems to work better and promote greater health and healing. So that should sound similar to that quote we heard from Andrew Still, right? So it's not just that they move joints around, but really, and if you talk to a chiropractor, what they're really going to say is by doing their adjustments, they are going to free up the nervous system, right? And if your nervous system is freed up, it's going to allow for better flow of nervous impulses. And what we know about the nervous system, right? The nervous system is in charge, really, right? All messages that go to your brain or leave your brain, they're going to have to get to the central nervous system and exit the central nervous system via nerves. So there has to be a free flow of electrical current, if you will, across these nerves for these messages to be transmitted. And this is the main way we communicate. Our body is able to communicate with another part of our body over a distance. We have two modes of distance communication in terms of systems. One is the nervous system and the other one is the endocrine system. So the nervous system is supremely important in the ability for us to transmit, to relay information from one place to another. So it stands to reason that this would be a helpful way to facilitate this type of communication. And that's what the chiropractic profession is really built on, right? It's not just pain. It's not just musculoskeletal issues, but by allowing this or decreasing the interference of transmission of impulses, hence messages, that can do all kinds of other things. It can treat organs, viscera. It can, potentially correct for all sorts of imbalances, from hypertension to earaches to, colic in a baby. So that's kind of what we think about or what chiropractic people sort of push. That's part of their philosophy, I guess, for lack of a better word. One thing I do want to say, and I'll say this again as we get going, but there are a great number of people who use their chiropractor as their primary care physician, right? And so chiropractors aren't technically physicians, although oftentimes they're referred to as doctors, but they're not physicians in the sense that they are not able to do surgery and they're not able to prescribe drugs, but they still are oftentimes serving in this capacity for many patients. And because of that, we've seen the scope of practice of chiropractors really expand. And some people think that's a good thing, and some people think that's not such a good thing. And that will be something that I think we're going to be able to debate in our discussion this week. Okay, so let's look at some facts, chiropractic facts. One is the education of the chiropractor focuses more on health instead of disease. That's very congruent with all sorts of holistic philosophy that we've already been sort of touching on. Again, to maintain the healthy function of the spine, that's their primary role. But of course, most chiropractors are also evaluating other factors relating to health. They're doing a lot more laboratory testing, not all, but some. They're doing a lot of dietary counseling. They do have a fair amount of training in nutrition, and so that stands to reason that that's a good role for them to play. I already mentioned that back pain is the number one reason for visits. Chiropractors are licensed in all 50 states, and they are recognized by the World Health Organization. And one of the things, again, I come to this class as a naturopathic physician. And naturopathic doctors and chiropractors, there's a lot of turf wars that go on in the holistic health world, for good or for bad. But one of the things that the chiropractors have been very effective at, which I think is why we see chiropractors seeing more patient visits than any other health professional, is that they have fought and really won a huge amount of insurance support. So more than 85% of health insurance plans cover treatment. And this is a big deal, right? People who have health insurance, they're going to want to be able to use their health insurance, right? None of us like to pay out of pocket for things if we're paying for health insurance. And because chiropractors have such good, they're so good at this, right? And they're strong lobbyers, right? They have a lot of power behind them because of their numbers. They've gotten a lot of traction in this arena, and I think that has really played a role in their success. All right, the chiropractors, of course, aren't the first people to talk about spinal manipulation. We already know that the osteopaths did, but we go way back, and I think I mentioned this in our conversation around the osteopaths. But this is what Hippocrates, who we know is the father of modern medicine, Hippocrates said that the spine was really important to health and disease, and you can see to get knowledge of the spine for this is the requisite for many diseases. And then 400 years after Hippocrates, Galen chimed in and he said to look to the nervous system as the key to health. Sorry, there's an extra M there. As the key to health. So, you know, the chiropractors didn't just dream this up. This had been already kind of thrown into the ring as way back as far as Hippocrates, and probably before that, right? Hippocrates is where we start to have some written record. And then, of course, Andrew Still and the osteopaths did a lot of talking about this as well. We already know that. And like I said, we think that Andrew Still was probably a key player in the formation of the chiropractic profession. All right, so I'm going to, just for time, I'm going to cut this video really quick and start up a new one with our beginning of our history and our founding father of the chiropractic profession, who is D.D. Palmer.